Traditional medicine should be given a chance in the fight against COVID-19. University of the Free State's Professor Motlalepula Matsabisa is also the chairperson of the World Health Organization's Regional Expert Advisory Committee on Traditional Medicines for COVID-19. He says more investment is needed in natural medicine. He was speaking at a seminar hosted to dispel myths about vaccines and variants, and he joins us now for more on this. Thank you very much, Professor, for your time this afternoon. So tell us, how can traditional medicine contribute to the fight against COVID-19?
Thank you so much for allowing me, to share, the views on traditional medicines. First, we believe that traditional medicines should be researched and should be tested before they can be outrightly accepted into our national, health policies. However, we're saying that, fair chances needs to be given for that research to happen. There needs to be equal, opportunities and equity in terms of how funding, of traditional medicines, is given and how it's being prioritized for diseases such as, COVID-19. Traditional medicines contributed, in the past pandemics like your Spanish flu, like your bubonic plagues. And at the time, we're arguing that people continued to use traditional medicines and there were actually no vaccines at the time. But also we see that vaccine treatments, whether it is through, COVID treatments, whether it is through vaccines or any pharmaceuticals, they play roles at different, phases of the disease. And we see that, the contribution of traditional medicines could actually contribute in terms of therapeutics, as a preventative measures, where people continue to use traditional medicines to prevent themselves from contracting, the disease. They could also contribute in terms of being antiviral, antioxidants, and that's at the different phase where you start off with your COVID phase 1 disease, where the disease is mild, and then also where you see that at the more severe cases where your antivirals that are currently used, in fact, are ineffective, but therefore you need then to rely on immune modulators. And that's really the reason why we're saying, let there be, a chance and a contribution that is fairly given to traditional medicines, for it to meaningfully contribute to the COVID-19. I think that was, our argument.
Tell us about the endorsed protocols for traditional medicine clinical trials.
Yeah. Through, the World Health, we, as experts from Africa, 25 different experts, developed up, protocols to assist member states in Africa to one, how then do they start off doing preclinical work? How then do we then go into clinical trial, and how do we capacitate countries that wish to do those clinical trials? So we have then, developed, phase 3 clinical trial protocols for COVID, and those protocols are based on the WHO standard protocols. But they've then been, adopted and adapted for traditional medicines, so that at least we know that the effect of traditional medicines that we see can be standardized, can be randomized and worked on a controlled environment. So we have now sent those to Geneva for adoption, and member states could actually use those protocols. And the 25 members, from the expert group that I chair on traditional medicines, are actually available to assist member states and to assist the researchers that want to conduct and run those clinical trials. And we want to talk to regulatory, authorities in our country, it is SAPRA, to say, let there, be a chance, that these medicines get tested properly. We know that people have been using these medicines and people claim that they find benefit from using those. So therefore, if people are saying we do find benefit from using traditional medicines, let us actually listen to them, but let us also use, proper methods such as the studies that we have developed to test those and ensure that at least they contribute to the fight against COVID.
So you're asking for fair investment. What would that translate to in monetary terms, and where do you expect that investment to come from?
We were asking, a fair, investment and a fair contribution, to the fight against COVID. One, because we realize that, two, in medicine, there is no single treatment that cures everything. Whether it is pain, you go to a doctor. You don't come up with one single Panadol. They give you a number of treatments because we know that diseases can't be treated by one thing. We argue the same and say with COVID, vaccines are there, but vaccines are preventative. Vaccines may not be curative. And therefore, even though we say vaccines are there, we have realized that in the past, there was a SARS-CoV-1. We failed to come up with a vaccine for that. There was HIV. We failed to come up with a vaccine for that. And the mistakes that we did was we put so much investment in one treatment option, and then when it failed, there was nowhere to go. And we are saying, let's learn from those mistakes and say, let us not put all our eggs in one basket, but let us open enough and say, there may be other treatment that needs to be supported. Now, where should that money come from? Governments supported the development of vaccines. Couldn't they support, I think, the research and the development of traditional medicines? And that's what we are asking for. How much are we asking for? We're not asking for billions and billions of rands, but we are literally saying, give us the opportunity, I think, give us the approval to do this, test fairly, and give us just some money to do the clinical trials. And we are asking that, give us that chance to test these traditional medicines. We're not asking for traditional medicines to be blanketly accepted, but we're asking them to be tested in methods and research approaches that are appropriate and relevant for traditional medicines.
Thank you very much for speaking to us. That was Professor Motlalepula Matsabisa, a chairperson of the World Health Organization's Regional Expert Advisory Committee on Traditional Medicines for COVID-19.